Hey, good morning. It's Dr. Mark Walter from Stem Cell Orthopedics in Sarasota. Just wanted to talk to you a little bit today about stem cell orthopedics. What an exciting new field. We now have some non-surgical ways that we can fix a ton of different types of problems. Let me actually give you a short description of what we do with stem cell orthopedics. We basically have regenerative injections where we're trying to get the body to heal itself. This concept has been around for a long time. Of course, in the last 6 or 10 years, we've actually made a lot of advances with being able to isolate your own stem cells in the office setting. And we usually use that with PRP, platelet-rich plasma, which are your growth factors from your blood. There's also other types of solutions that we use that we've used for many, many years. The field has been around for over 60 or 80 years. C. Everett Koop, our former Surgeon General, was a great believer in regenerative injections, and they can be useful for many, many types of orthopedic problems. And for anybody who has a serious orthopedic issue, this is certainly something you should look into prior to doing surgery or more invasive approaches. What we're really good with in stem cell orthopedics is the connective tissues, the ligaments, the tendons, the myofascia, and you may or may not realize it, but actually the majority of musculoskeletal pain actually comes from that. We always think of musculoskeletal pain in the classical sense as coming from bone, cartilage, nerve, or discs. And actually the connective tissues are often a much bigger component of the pain. For example, in knee pain, okay, this is a little model of your knee. When you're 20 years old, your cartilage space is that, and when you're 50 or 60 or 70, your cartilage space is eroded. The capsule, which was once tight, holding this joint together, is now, the capsule which was once tight is now loose. So you have pain, yes, from the famous bone on bone, but you also have pain from instability, this type of motion. And if you look at the ligamentous attachments in the knee here, where they attach to the bone here, an inch below or an inch above the joint, these are exquisitely, these are big pain generators, and we can, if we identify those as a major pain generator in your case, then there might be a much simpler way to make a huge difference in the pain and help rebuild and regenerate the joint. So stem cells are very exciting these days. We now have the capacity to regenerate almost any tissue in the body. And of course, we've used stem cells for orthopedic applications for the longest. Our experience is the longest. This is a very safe treatment, particularly if you use the stem cells from your own body. I really believe in that. I like the stem cells from fat the best, actually. And the freshness of the stem cells is also very important, because in many cases it's the growth factors that make a huge difference. So whether you have back pain, shoulder pain, knee pain, thumb pain, let me go through a couple of things that we can treat. Basically almost anything from Achilles tendonitis to neck pain, and anything in between, elbow, shoulder, thumb. Thumb is quite common. This is a very good application of stem cell orthopedics. Knee, hip, back. Very often back pain. Let me talk to you a little bit about back pain. So here we have a skeleton, and very often, yes, the pain could be from the discs and so on, but in many cases it might actually be from the pelvis. Let me bring Sam a little closer. Sam, the super skeleton. So in many cases, it's not the discs. Okay, here you have a disc protrusion, and that might be an issue. Sorry, you may not see it that well. But the pelvis is a huge area, okay? And sciatica, it's virtually impossible to tell. Is it coming from your pelvis or is it coming from the discs? And of course, the moment you do an MRI, if you see an abnormality on the discs, we assume that that's the cause of the pain, but in fact, it might actually be the pelvis. And very importantly, what we do, the way we examine you in regenerative orthopedics might be totally different than conventional surgical orthopedics. Yes, MRI, ultrasound, all of that is very interesting, but for us, we really want to find not where the anatomic abnormalities are, but what's the pain generator, and we want to actually be able to prioritize where is the pain generator. If a patient comes to see me, their main problem is, hey, I've got pain, fix the pain. So we want to find what is the primary pain generator. That's the question. And one way, we have what we call a palpation interrogation test, where we carefully palpate the tissues to find what's causing the pain. So Mr. Smith has come, or Mrs. Smith has come to see me. I'm going to examine them and I'm going to get them on the table, and with about 20 pounds of pressure, I'm going to use my thumb. I'm going to carefully palpate. Mr. Smith, Mrs. Smith, is the pain here? Is it here? Is it here? Is it here? Or is it here? And when I get down to here, Mr. or Mrs. Smith might jump off the table, and I would have reproduced their pain. So my finger's on the problem. So this, in a way, is not only is actually just virtually diagnostic. This is the pain generator. Even though the MRI might show abnormalities in the discs and so on, this might just be an incidental finding of an anatomic abnormality, but it may not be the pain generator. That's why back surgery does not have a great track record in terms of fixing the pain. Let's say only 30% of back surgeries actually are successful in fixing the pain because they have not identified the primary pain generator. So this just gives you a little glimpse into stem cell orthopedics. It's an exciting new field. I feel in the future this really should be a primary care orthopedics. If a person has a persistent pain of more than about 4 or 5 weeks, regenerative doctor should be the first doctor you see, because there might be a fairly simple non-surgical way to fix this. Yes, unfortunately, it's not covered under insurance, so the treatment can vary anywhere from $400 to $7,000 or $8,000, okay, depending on what's involved and what areas are involved, and do you use stem cells or do you use other regenerative solutions. So we have many choices at our disposal. The important thing is that we identify, yes, this would be a person would be a good candidate, and this would be a really good way to fix it. All right, so my goal, of course, is to help people. If there's any way to avoid invasive surgery, let's do it. And in many cases, if it turns out to be a connective tissue structure, like a ligament, tendon, the myofascia, if it turns out that the pain generators are there, regenerative injections might be the only way to fix it, because the surgical approach will not work. So I urge you, look at my website, stemcellorthopedics.com. We're here for you. Please phone us if you have interest. We have various videos. Please go to our YouTube station and sign up on our channel so you'll get these videos. If this is of interest to you, subscribe to us so you'll be sent the videos, and we'll keep you up to date. We're here for you, so please do connect with us. And we'll be happy to, share our information that we have. Okay, thanks for tuning in. We'll hope to see you soon. Talk to you soon. Bye.